You're watching WDEF News 12 this morning with Rachel Esch, meteorologist Brian Smith, and your time-saver traffic tracker with Sunny 92.3's James Howard.
Good morning. October is Breast Cancer Awareness Month. Joining us to talk about the disease is Dr. Angie Larson. Thanks for joining us today.
Good morning.
This, of course, is Breast Cancer Awareness Month, and that's important. Why?
Well, all women are at risk for breast cancer. Statistically, 1 in 8 women will be diagnosed during their life with breast cancer.
Wow. Do we know why?
I wish we did. We're working on that, but we don't have all the answers. We know a lot more than we used to, but we still have a lot to learn.
The good news is early detection really helps save lives.
Absolutely. Over the past 2 decades, we've been seeing fewer cases of breast cancer and fewer breast cancer deaths. Breast Cancer Awareness Month, October, is so important because that is a great reminder for all of us to get mammograms and just to be aware that breast cancer is the number 2 cancer killer for women.
And of course, are those the main things we can do to reduce our risk?
No, risk, of course, is different than detection. There are a lot of things we can do to decrease our risk.
Such as?
Well, number 1, leading a healthy lifestyle, which is good for us for everything. So trying to maintain an ideal body weight, eat healthy foods, cut down on alcohol use. Statistics have shown that more than 2 to 5 drinks a day can lead to an increased breast cancer risk. Things like that.
What about male breast cancer? We're hearing more about that these days.
Men can get breast cancer. There are about just under 2,000 cases of male breast cancer per year.
What about treatments once we find breast cancer?
The good news is that our treatments are getting better and better with new technology, with the improved awareness we have about the need for breast centers where patients can get the very best care. That's getting better and better.
And you guys, of course, have a center at Memorial. What do you offer there?
We do. As a new physician in this community, I feel very fortunate to be there. We offer a comprehensive range of breast care services, from diagnostic services, mammograms, to then if a woman has an abnormal mammogram or feels something abnormal in her breast, we have special doctors trained to do only breast cancer care or address other breast issues. And then we also have nurse educators, we have genetic counseling, and we have our Cancer Resource Center.
And quickly for folks, as far as mammograms, when should we have those?
Our standard recommendation is starting at the age of 40, all women should have a mammogram. Based on your family history, you should consult with your doctor. For you, it might be better to start earlier.
And as far as self-breast exams?
I know there's been some controversy about that, and that's a great question, one I hear a lot from patients. What we recommend is that women do a breast self-exam about once a month, not to try to diagnose all breast issues, but just to get used to what their own breasts feel like, so that if they notice a worrisome change, they'll pick up on it as quickly as possible.
I want to thank you for joining us today. Here's the information. Dr. Angie Larson is with the Breast Center of Chattanooga, of course at Memorial on Glenwood Drive. The number to call for more information is 698-0304. You can go to their website, which is memorial.org, and of course it has all the information for you there. Just go underneath, of course, their Breast Services Center, and there's a live look at their front page for you this morning. Thanks for joining us.
Thank you.
Stay with us. We'll take a short break and be back. This is WDEF News 12 this morning.